Well, hello again, friends, sufferers, and fellow humans. Now, if you are watching this, as you can see, I'm trying something slightly different, recording outside today. It should be a pleasant distraction from my otherwise droning on answering the question today, which is, who should I see about my lower back pain or sciatica? Of course, a very loaded question, especially coming from an osteopath. So we'll kick off with the obvious answer. And the obvious answer for who should I see about my lower back pain or sciatica is, according to the clinical guidelines, you could see an osteopath, chiropractor, manipulative physiotherapist. Of course, you could see your own doctor, but those guidelines are very much focused on short term. There is good evidence that physical therapies are helpful at relieving lower back pain and sciatica in the short term. So there's the obvious answer, osteo, chiro, manipulative physio. But of course, the less obvious answer is, if we're thinking about long term, and the long term solution to lower back pain, of course, is very much focused on lifestyle, exercise, etc. So you could see a fitness instructor or a movement professional. You could see a counsellor because it may be that you need help in changing some of your habits. You could see a clinical psychologist, a clinical hypnotherapist. There's all sorts of people who could be extremely well placed to help you in the long-term resolution of lower back pain and sciatica. So we're not talking here just about treatment, we're talking about the prevention piece as well. So not just relief, but remember, getting as far back from the edge of that cliff of pain as possible. You have to do the prevention piece. So there's the first part of the answer to who should you see. Yes, there's the obvious characters such as myself, but there's also a whole host of other people who could feed into supporting you in that long-term habit changing and learning how to move better, be fitter, stronger, all of those things. Now, the second point I want to make on this is who should you see about lower back pain or sciatica is very much someone who specialises. Now, if I just wanted my teeth cleaned, I could go to a dental hygienist. And of course, I would like a very good dental hygienist, but really all I need is my teeth cleaned, so dental hygienist will do. If I want a checkup, I go to my dentist. If I want a complete overhaul of my dental makeup, then I go to see an orthodontist, someone who specialises in exactly that. So I'm sure you can see where I'm going with this point. If you want the best possible solution to your lower back pain or sciatica, choose someone who specialises in that field. Not a jack of all trades and master of none, but someone who that is their craft, that is the science that they have studied. And that is your best chance of a long-term resolution to your problem. Is don't go for the jack of all trades, choose the master. Okay, so that's the second point, and who should you choose or who could you see for lower back pain or sciatica. The third point I want to make is please choose someone that gives you positive and empowering messages, not someone who makes you dependent on their treatment. And this is extremely important. We know that there's all sorts of people who can assist you in the relief of your lower back pain. But if all they do is do things to you, then they're not empowering you. It is vitally important that you understand what got you into this mess so that you can ensure you're reducing the risk that it doesn't happen again. Reducing the risk that it does happen again. I'm confusing myself, too many negatives there. So it's very important that you consult someone who gives you, who educates you, who supports you in behaviour change, who really, as I say, empowers you to reduce the risk that this will ever happen to you again. So that's the third point. You should make sure whoever you consult is giving you positive messages and empowering you to reduce the risk. Now, related to that, the fourth point I wanted to make is make sure when you're consulting someone who's going to help you with your lower back pain or sciatica that they do not use scary labels. It's very easy in our industry to blind you with science, to tell you things that you just don't have the backdrop of knowledge to understand. And that in itself is stress inducing and causes more anxiety. And you should know by now, if you've listened to a lot of my stuff, anxiety just turns the volume up on your pain. So it's very important that you see someone who demystifies and makes it as simple as possible so that you understand what's wrong with you and how that came about. We don't need fancy labels. We use what we call a functional assessment label, which, to be fair, sometimes can sound complex, but when you break it down, it's all about explaining how long you've had your problem, so the duration, what makes it worse, what makes it better, so whether that's moving forwards or backwards, and essentially an anatomical description, so where is your pain. We don't go into prolapsed discs and locked joints and all those sorts of things. Those may be relevant in the short term, but they're definitely not relevant in the long term. So it's very important that whoever you consult doesn't use scary labels and breaks it down for you and makes it simple so that you understand how you can help yourself. Now, I think a very important fifth point is that that person helps you to set a big motivating goal. So I've said this many times before, when you have lower back pain and or sciatica and you're slowly recovering or maybe even rapidly recovering, you're very good, or many people are good at doing their exercises and following the advice. But as soon as you start to feel better, even just a little better, many people revert to their old habits. So if you're really seeking a long-term prevention of the recurrence of your pain, you need to stay motivated. You need to keep following the path, doing all the small steps that will finally get you to where you want to get to, which is way back from the edge of that cliff of pain. You want to radically reduce the risk that this is going to happen to you again, then you have to stay motivated. And the way of doing that is not to just say, oh, I want to be pain-free. You have to have a much bigger goal than that. And that's related to all the risk factors that pushed you closer to the edge in the first place. It's very important. Fundamentally, the fitter and healthier and stronger your back is, and you are, the less risk that this is going to happen again. So I would say when you're choosing who to help support you to relieve and prevent your lower back pain and sciatica, make sure that person encourages you to set big, motivating goals. And ideally a SMART goal: specific, measurable, achievable, relevant, and timely. That gives you the maximum chance that you're actually going to stick to this and that you're going to see it through all the way to get to that healthier version of you so that you're much less at risk of this happening again. And just to kind of close the loop as I make that fifth point on who should you see, I'll go all the way back to the first point and talk about, I mentioned in that first point, fitness professionals and movement professionals. Now, particularly personal trainers are very good at helping you to articulate a SMART goal, a big goal. So I think that fitness professionals could play a hugely important role in helping to keep you on track to make sure that you're reducing that risk and not ending up back, as I call it, in the sea of pain again, whether that be, 10 weeks later, 10 months later, or whenever. So just to review, the 5 points are: you could see any one of a number of people. The obvious ones are osteo-chiro, physio, but you could certainly see a counsellor, a psychologist, a fitness professional. Make sure, point number 2, that whoever you see specialises. Number 3, that they give you positive and empowering messages. Number 4, they do not attach a scary label to your problem and cause more anxiety for you. And number 5, make sure that that person is helping you to set a big goal that's much more than just being about pain relief. And that's it. That's it. So let me know, send me a message if you've enjoyed the backdrop in this video. But if you're listening in on the podcast, then equally let me know, and look forward to catching up with you again soon. Bye-bye.